Hi there, my name is Darrian. I'm going to be your nurse today.
Darren.
Hi. So I've already gone over my patient's chart, gotten a report. So I'm going to start by asking you, have you had any abdominal or chest pain at all lately?
I have stomach pain, like right here in the middle of my stomach, and I have an ache in my upper chest. That's
Okay. Any nausea or vomiting or dizziness?
about it. I just feel tired. Yeah, no dizziness.
Shortness of breath or palpitations?
No shortness of breath and no palpitations.
Okay. And any alcohol or caffeine use?
I have a glass of wine with dinner sometimes, and one coffee a
Dysphagia?
no.
Okay, perfect. So I've already done my OPQRSTU, so I'm going to go ahead and talk about the vitals. So my patient was hypertensive with blood pressure of 167 over, I believe, 101, and the heart rate was 105, so they are tachycardic as well. So now I'm going to go in and do my inspection with my patient. So upon inspection, I am noting that there's no work of breathing, no increased work of breathing, no shortness of breath, no diaphoresis, no cyanosis, no pallor. Um, there's no obvious jugular venous distension as well, and he's not diaphoretic. And then when I go into the GI, you just sit back for this one. With the GI, I'm noting that there's no lumps, bumps, or lesions or striae, no bruising, um, and its contour in the umbilicus is midline as well. Perfect. And now I'm also going to go in and auscultate first, starting with the cardiac. So when I auscultate, I'm starting at the aortic here at the clavicular line, second intercostal space. And I'm going to listen here for a minute in each spot. And then I have the pulmonic area here, and then Erb's point, tricuspid, and then mitral, which is also my apical pulse. And I'm going to listen here for 1 minute to get the true heart rate, as well as listen for any murmurs. Then I would go in with the bell of my stethoscope and go in the same formation again, listening for any murmurs as well, which would sound kind of like a whooshing sound. And I would listen over here for them mostly as well. And then I'm going to go in with the GI if you want to lay down for me for that one. So I'm going to start in the right lower quadrant, and I'm always going to auscultate first, trying to keep away from what I'm palpitating. I'm going to keep away from the painful areas in the mid-apigastric. So I'm going to listen here first in the little Z formation for a minute in each spot, making sure that I hear bowel sounds. If I don't, I'm going to listen for a full 5 minutes. In the right lower quadrant, I have the appendix. The right upper, I have the liver. The left upper, I have the stomach. And the left lower, I have the descending colon as well. Okay, beautiful. And then I'm going to go in, if you want to sit up again, sorry, I'm going to check the pulses. So I'm going to start with your carotid over here. Okay, once I felt that, and then I would do the brachial, which is in here. Sorry, I just don't want the camera to see. About here, and then here. And then the radial, they're all bounding, which is great. Perfect. And then the dorsalis fatal pulses. I don't think you can see that. It's right on top of the foot there. Boom. Another one. Boom. Okay. And then I'm gonna go in if you want to lay down one more time. Sorry. In the stomach area, I'm gonna do percussion. So essentially when I'm over a hollow organ, I want to hear a tympanic sound. If I was over something solid, it would sound dull, like a dullness, like over the rib area. And then I'm gonna go in and I'm gonna do my I'm gonna palpate now, which is something I do last. So I'm gonna go about 1 to 2 centimeters deep in the same formation, feeling for any like lumps, bumps, bruising. or not bruising, sorry, just lumps and bumps. Um, Perfect. Okay, so that's great. You can sit up, and I think, yeah.
What do you think is going on with this patient?
They're having a myocardial infarction or an angina attack.
What are two other nursing interventions that may be required for this patient and why?
Frequent vitals and cardiac monitoring, as well as applying oxygen to the patient.
What are two physician's orders that you may expect for this patient and why?
I would expect the physician to order nitro spray, ECGs, and ECG and troponins as well.